Uh, Thank you. Well, I think it's, first of all, let me just acknowledge, rare do you get uh, community leaders, department and agency heads, rare do you get practitioners, experts in their field, but also two mayors, and two assembly members, and two senators together for an event like this. I'm humbled and grateful. I mean it to all of you that you would take your time out of your busy schedule to be here today, to have the chance to listen to one another and listen to different points of view expressed in the meeting we just had, including from the former presiding judge of the mental health court here in Napa County. It's good to be back here at one of our 5 state hospitals. This state hospital is well known in the state of California, and as Darrell Steinberg noted, this state hospital has gone through many different incarnations, not least of which, having just left a brief tour, you can see the vestiges of approaches and policies of the past. One notable vestige is a procedure room that still exists today in this hospital, where you see an observatory above the room where people observed lobotomies not that many years ago that were being performed consistently here behind these walls. The history of institutionalization, the history of deinstitutionalization, the history of a process that unfolded not in a single act, but over the course of many, many decades, with the advent of psychotropic drugs, with the advent of a civil liberties movement, with the advent of those that were looking for a different paradigm and approach, some that were more sincere than others in terms of providing those supports, particularly out of institutions like this back into the community. Nonetheless, one of 5 institutions of a type in the state of California, anywhere from 5,000 to 7,000 people, depending on the year, being served in these institutions, primarily those that are here under what we refer to as LPS conservatorships, Lanterman Petra Short Act conservatorships established in the 60s, and under what we refer to as IST, those that are here in competence to stand trial themselves. These are the individuals that so often we come into contact with out on the streets and sidewalks, as was mentioned, that are struggling with addictions, struggling with the challenges of mental health, those with bipolar disorder, schizophrenia, paranoia, those broadly defined on the schizophrenia spectrum, or those with psychotic disorders that disproportionately, as was underscored in our meeting, are self-medicating with drug and alcohol addictions. Those that are duly diagnosed by definition and as a consequence need unique, individualized, and appropriate care, and often that is simply not available in a state that has provided scarce resources over the last 50 or so years. That, in the spirit of this event today, is about to change. In fact, over the last few years, it has begun to change. I want to just thank all the assembly member leaders that are here and senators that are here for their extraordinary leadership. Senator Dodd couldn't be more right. We haven't just been sitting back passively on the issue of what's happening on the streets and sidewalks or in people's homes. Those that struggle, families that struggle invisibly every single day with a loved one, maybe themselves, that are struggling with behavioral health issues. We haven't been sitting back talking about the good old days, just pointing fingers. We've been in the process of designing a new approach and a new paradigm. And that's the spirit that brings us here today. $12 billion was approved just last year to advance our efforts to provide more housing, which is foundational in support, to provide more services ongoing, to provide the resources that are needed to get people successfully back up on their feet and back in their homes and their community and back to self-sufficiency. And this year, we're asking the legislature, in partnership with the legislature, for an additional $2 billion to advance that cause. 33,000 units, 33 specific, 1,000 units, 33,000 new units of housing and slots specifically for those struggling with severe mental illness and those that are struggling with substance abuse disorder. Those are resources that have never been presented in the history of the state of California. And that is just one bucket of funding, of many different buckets of funding. And perhaps one of the most significant buckets of funding that hasn't been highlighted as much as it should was the work we did last year with the legislature to provide $4 billion specifically for prevention services and screening services for our most vulnerable, our youth, ages 0 to 26. The state of California is doing what no other state's doing, $4 billion to provide comprehensive, universal screening and support for all our children 0 to 26 that are struggling. So many obviously been highlighted over the course of the last 2 years with the pandemic, but so many others that have been neglected for decades. California is stepping up in those efforts. So we have many different buckets of funding, many different approaches and strategies, but the one that brings us here today, and I'll briefly try to sum up, is this care court. It's a recognition that if you don't like the answer, you got to ask a better question. It's a recognition that if you continue to do what you've done, you'll only get what you got. It's a recognition that we need to do things differently. It's a recognition we need to ask better questions. It's a recognition that we need to find new approaches. We've been stuck, I'll be candid with you, stuck for decades in a stale debate about whether or not we should reform a system that was designed in a world that no longer exists. The LPS, other conservatorship frameworks that are well established here in the step, were established, many of them, in the 60s, well over half a century ago. The world's changed. The capacity now to get medication, injectable medications that are longer lasting, provides opportunities anew that didn't exist in the 60s. But our approach is consistently been framed in reforming those old paradigms, reforming LPS and conservatorship, reforming in the context of efforts like Laura's Law. And by the way, Laura's Law, we did reform a few years ago, but only 218 people were served last year. 218 people. You heard Senator Bloom, our critical author, along with Senator Umberg, just mention LA County's severe mental health population alone, 218 people. And Laura's Law is just not going to do it. Nor are building more institutions respectfully like this, which is really an expression of our failure to go upstream to help people before they enter into the criminal justice system, before they're incompetent to stand trial, before they commit crimes and assaults on others, and often provide harm to themselves. And so we are looking at this anew, not reforming LPS, not reforming Laura's Law, though we can have those debates, and I embrace those debates, but leaping forward with this new paradigm to advance the cause that I think unites 90% of us in this state. What the hell are we doing about those that are struggling out on our streets and sidewalks? When can we hold ourselves to a higher level of accountability? I appreciate Senator Umberg talking about his days with the Clinton administration. I long talk about that frame that Bill Clinton himself advanced around community, opportunity, and responsibility. But what was missing, what is missing today, yes, community, critical, responsibility, opportunity, but accountability. We need to all be held to a higher level of accountability, each and every one of us. That's the spirit that Mayor Steinberg brought to this table. All of us, individually, collectively, individuals that include patients themselves. And that's why we want to approach this with a different referral process, open up referrals, to provide more opportunity for people that are struggling, to provide a screening process and a care plan that has due process, public defenders, new community support, but also accountability for the individual to complete that plan, and for the county to be there to secure that plan along with the courts. And so our approach is novel in California's recent, perhaps historically, and our entire history, and it's an approach that we think is long overdue. We finance it, not just with money, but a more resourceful framework and mindset, being more creative and humble, that we need to be open, as I was saying to all of us earlier, open to argument, interested in the results or lack thereof that we produce as we advance this cause. So we're here in that spirit. I'm grateful for everybody that's leaning in. I'm grateful for the legislative leadership that's willing to take this baton. I'm grateful for the patient advocates. I'm grateful for the disability rights community. I'm grateful to all of those that are part of this process, those that express concern, as well as those that express frustration, demanding reform, demanding change. We're poised to deliver on that, and I think it's long overdue in the state of California, and it can't happen soon enough. So that's the spirit of our visit. Gratitude again expressed to all that made it possible, and appreciation for those of you that showed up. And of course, we're here to answer any questions.
Hi, Governor. My name is Ashley Zavala with Nexstar Media Group. Now that you've had a chance to sit down with local leaders in a couple of these types of roundtables, do you have a better sense of how much this could cost? I know you've mentioned that $4 billion appropriation, but any idea on what a price tag on this program looks like?
I think what I'm hearing is we're already spending all the money. We heard Mayor Napa today talk about the costs just associated with the fire department here, and paramedics, police department, and the amount of money they're spending on overtime, on helping folks on the streets and sidewalks over and over and over again, the cost of uncompensated care in your county hospital, the cost of a criminal justice system where judges, public defenders see people over and over and over and over again. The money is not the issue. I, with respect, would argue that's not the principal issue. Not with the incredible leadership of Darrell Steinberg and the mental health dollars that he's provided through Prop 63 and the public supported, increasing from $2.1 billion 2 years ago to $3.8 billion this year. Now with the $14 billion of new funding that, if we support this year's budget, will have been appropriated and applied to this issue just on the homeless housing and supportive service model, in addition the $4 billion. And I didn't even talk about all the other resources we're providing with our CalAIM proposal, which is the integration as the supervisor. And I thank the supervisor for being here. Her leadership has been demonstrable in this space, as she reminds us, in every opportunity, the integration of brain health and physical health. All of those resources are now on the table, but those resources are also exhausted every single year in a completely fragmented, disconnected system.
Thank you for that. And thank you for the update on Care Court. For lack of a better term, I want to shift gears to your proposal that you made yesterday for the gas situation. One of the reactions that we're getting is on equity in this proposal that relies on vehicle registration and not tax records or income. Some have pointed to the example, an individual who owns a Mercedes-Benz and a Tesla, because electric vehicles are eligible under this plan, would be able to get $800. Your response to that kind of reaction to your plan?
It's not untrue. And I'm completely open. We made this clear yesterday, and I'll reinforce it today, to work with the legislature if they want to create a framework of means testing. In fact, we've already initiated that going back a week or so ago, looking to see what's possible in terms of the VIN numbers, the registration at the DMV, to make that determination of the value of the vehicles. So I'm very open to that discussion, but I'm also very resolved to get money back in the pockets of people that have been impacted, not just by gas prices, but across the board, every one of us impacted, all of us, by the cost of living and inflation and the other challenges we're facing that have only been exacerbated because of war in Ukraine and petrodictators that manipulate markets on a consistent basis. I should note that our proposal, like the other legislative proposals, moves monies to individuals, and it subsidizes the costs directly, not indirectly, by subsidizing corporations. We subsidize Californians. And our approach, we think, is a preferable approach. And that approach, I look forward to working with the legislature to advance and to adjust over the course of the next few weeks. And I'm confident we will land on an agreement in very short order.
Okay, one more question from me. Your office mentioned July was likely when the payments could go out. You and the legislature have been able to work in the past on urgency funding, COVID relief, paid sick time. Why not sooner?
Well, it's tens of millions of checks. We're still providing $10+ billion of checks to Californians from our Golden State stimulus. And I want to remind everybody, we provided $10 billion in stimulus checks, $600 checks, to roughly 3/4 of tax filers, or rather 3/4 of Californians in the state of California. And those dollars are still going out. It takes time to get those dollars out. As you know, the Franchise Tax Board currently is working on tax returns, which I think is a top priority for their distribution and administration. But we've got to work through the legislative process. We've got to approve a process, and then we've got to distribute either through direct deposit if we decide the FTB approach, or through debit cards if we do it the DMV approach, a process where we get those dollars out. So we look forward to getting those out. If you consider what we did last year, this is remarkable. And what we're proposing this year, $20 billion of tax refunds. No state in American history has ever provided that kind of relief. I'm really proud of that. And so we'll work together. We'll work through these issues. By the way, it's not just for cars. It's also to provide free public transit. It's also to provide hundreds of millions of dollars for more bicycle and pedestrian safety improvements. And I should note a distinction in our proposal that I think is important and I hope is highlighted. Many people are left out of other proposals, particularly people with Social Security disability benefits. They were left out of the Golden State stimulus. I don't want to leave them out of this approach. And that's why our approach with the DMV is a little different than the other ones being offered. I think SSDI recipients deserve these dollars. I think people without documentation, that don't file taxes, that also own vehicles, could benefit from this. That's a different approach that we have than currently is being offered. And I believe our approach also will provide for people that don't file taxes for other reasons because they're low spectrum, that also own vehicles. So very low income people also are a beneficiary of our debit card approach, which again will just take a little bit more time, but ultimately will begin in the next 90 days if we indeed move quickly to resolve our modest differences between the legislative proposals.
Tom Bakar from Channel 2 KTVU in the Bay Area. I was listening and three questions popped up. Who cannot be taken to care court? How will you assure us that it's not abused by families and first responders? And thirdly, how will you assure that it's constitutional and not a full employment act for lawyers?
I don't know about the latter. It seems the Republican Party is consumed by the Full Employment Act for lawyers by weaponizing citizens to sue, as they're doing in Florida and Texas and elsewhere on a myriad of social issues to advance the cultural war. Our approach here is to mitigate the impacts and costs on the downstream in the criminal justice system, saving taxpayers money, saving the court time by having these specialty courts, and as Senator Umberg said, having specialty training to adjudicate the individual needs, to have a process which we are designing with the Judicial Council, to answer your question, to provide care plans that are court ordered with support of public defenders and community advocates, and to provide some continuity of care that will reduce costs ultimately because people will be served in a more sustainable, less situational manner. As it relates to the current process, as you know well, we have on average over 100,000. In fact, I think a year ago it was 114,000 people that entered our 5150 system. That's a very costly proposal. You all are very familiar with 5150s, 5250s as well. 114,000 just a couple years ago that went through that system. A little less last year because of COVID and other related issues. The costs are borne across the spectrum in that space. And again, we are looking to reimagine, redesign upstream a system of care that would mitigate those costs, those points of contact, reduce bureaucracy, reduce the burden on the taxpayers, reduce, as one may reframe, a full employment act, which is well established in the status quo, but in a fragmented and not sustainable way. So this is an opportunity to work with the legislature. We'll be providing the details of the plan to answer the question in more detail in April next month. and a process will unfold with the legislature and the public shortly thereafter, and of course over the course of the next few years as we implement.
Potential for abuse by either first responders or families that want to get rid of somebody they just don't want to have around anymore.
Well, one has to mitigate that, and that's why there's a public defender. That's why there's a court process. That's why there's not just a referral. There is a process of screening to adjudicate the merits or demerits of the same. So we're quite specific and quite prescriptive in terms of how that process unfolds, including new community supporters that are also a requirement of this process. So that's always going to be the case, but I will argue there is no greater case for the urgency of this initiative than the case that's made every single hour of every single day in the state of California as we navigate the streets and sidewalks and we see at scale the failure of our current system. That is abusive, and that is inhumane. To see the kind of abuses that are described in newspaper articles or on nightly news that we see on a weekly basis of some soul whose life is lost because we didn't have the courage to try something new, that to me is the ultimate abuse.
Thank you, Governor. I'm told that was the final question.
Great. Thank you. And with that, I just want to thank everybody once again for your extraordinary leadership and support and patience. As you can see, we've got a lot of important work to do with the legislature, and I couldn't be more blessed to have the kind of partners we have in Sacramento. Thank you. Take care, everybody.